This is Cervical Cancer by Addison, Brian, Kayla, and Kylie.
Okay, so a brief overview of cervical cancer. There are 5 different types of gynecologic cancers that happens in the woman's reproductive organs, including cervical, ovarian, uterine, vaginal, and vulvar. Cervical cancer starts in the lining of the cervix. The cervix connects to the uterus and the vagina. Cancer starts to form here when the cells begin to overproduce, which leads to a malignant tumor on the cervix. The endocervix, which is the opening of the cervix that leads to the uterus, is covered with glandular cells. The exocervix is the outer part of the cervix that is seen by the doctor during an exam. It is covered with squamous cells. During the cervical cancer, these cells overproduce. A bump on the cervix may indicate cervical cancer, but not always. Early stages of cervical cancer doesn't usually have symptoms.
In the United States, Hispanic women are most likely to get cervical cancer, followed by African Americans, American Indians, and Alaskan Natives and whites. Asians and Pacific Islanders have the lowest risk of cervical cancer in this country. The American Cancer Society estimates for cervical cancer in the United States for 2020 are about 13,800 new cases of invasive cervical cancer will be diagnosed, and about 4,290 women will die from cervical cancer. Cervical cancer was once one of the most common causes of cancer deaths for American women. The cervical cancer death rate dropped significantly with the increased use of the Pap test. This screening procedure can find changes in the cervix before cancer develops. It can also find cervical cancer early when it is smaller and easier to cure. Cervical cancer is most frequently diagnosed in women between the ages of 35 and 44, with the average age of diagnosis being 50. It rarely develops in women younger than 20. Many older women do not realize that the risk of developing cervical cancer is still present as they age. More than 20% of cases in cervical cancer are found in women over 65. However, these cancers rarely occur in women who have been getting regular tests to screen for cervical cancer before the age of 65. Cervical cancer starts with the invasive squamous cell carcinoma of the cervix, where the abnormal cells are confined to the epithelium. This stage of non-invasive disease is known as cervical intraepithelial neoplasm, also known as CIN. It is directly related to the processes of infection and integration of HPV. There are 3 CIN stages, CIN 1, 2, and 3. The development of CIN involves the progression from early changes CIN 1, involving the deeper layers of the epithelium, to the full thickness involvement at its more severe CIN 3, equating to the carcinoma in situ. This means a group of abnormal cells that remain in the place where they first formed. They have not spread. These abnormal cells may become cancer and spread into nearby normal tissues. CIN1 overlaps with HPV infection and usually resolves spontaneously within 9 to 12 months. CIN2, nuclear pleomorphism, with meiotic activity extending to the upper 2/3 of the epithelium. There is usually little or no kelocytosis, moderate dysplasia. This can happen between 2 to 10 years of development, with 40% resolvement spontaneously within 5 years. CIN3, nuclear pleomorphism, involves the full thickness of a squamous epithelium with meiotic activity at all levels. This is severe. This equates to carcinoma in situ, and development is the same as CIN2 with higher risk and resolvement when diagnosed.
Okay, the predisposing factors. HPV is the biggest risk factor. Once a woman has contracted the HPV infection, they can develop warts on the genital area, which then leads to complications like cervical cancer. Sexual history, as you have sex at a young age, it puts you at a higher risk and having multiple partners, which also increases your chances of having HPV. Smoking. Tobacco byproducts have been found in cervical mucus of women who smoke. Researchers believe that these substances damage the DNA of the cervix cells and may contribute to the development of cervical cancer. Suppressed immune system makes it harder to fight off cancer cells. STDs. Many women who have had chlamydia in the past have also had cervical cancer in the future. Long-time use of birth control pills. Research has shown to show the increase for cervical cancer. Women who have had 3 or more full-term pregnancies have an increased risk of developing cervical cancers. It is thought that is probably due to the increased exposure to HPV infection with sexual activity. Low income makes you have less resources to care for vaginal health. And poor diet increases your risk. And then lastly, sometimes you can't control your risk. Sometimes it's just hereditary.
Okay, so for the symptoms, one can experience blood spots or light bleeding between or following periods, heavy, long menstrual bleeding, bleeding after intercourse, increased vaginal discharge, pain during sexual intercourse, bleeding after menopause, and unexplained persistent pelvic pain. If any of these symptoms occur, it should be reported to your doctor. The earlier it can be detected, the better the outcome. Many of these symptoms can occur for other less concerning reasons, but discovering the exact reason is important for the health of the individual. So cervical cancer can have some complications. The first one is early menopause. If the ovaries are surgically removed or damaged during treatment of the cancer, a woman can go into early menopause. To treat cervical cancer, radiotherapy can be used, which can cause a narrowing of the vagina, which can make intercourse more painful and difficult. Lymphedema can be a complication. The lymph nodes in the pelvic area have to be surgically removed. Obviously, there's a lot of emotions involved in cancer, and that is an important complication. In advanced cervical cancer, there can be pain if the cancer spreads to the nerve endings, bones, or muscles, especially. Kidney failure can also occur if the tumor causes urine backup in the kidneys by growing bigger and blocking the urine transfer to the bladder. Blood clots can form because cancer makes the blood stickier, and bed rest can increase the chance by decreasing activity levels. If the cancer spreads to the vagina, bowel, or bladder, it can cause damage there, causing bleeding. And very rarely, a fistula can form in advanced cervical cancer, usually forming between the vagina and bladder, which can cause constant discharge, and this is a very dangerous complication.
Next is treatment. There are a lot of different treatment options, the first being surgery. Surgery all depends on where the cancer is centered. Pre-surgery options mostly involves killing cells using cryosurgery or laser ablation, or removing small pieces of cervix tissue called conization. Invasive cancer surgery options involves removing the portion of the cervix that has been diagnosed as cancerous. Radiation therapy is another option and can be used as the main treatment, or if the cancer has spread or come back. The 2 types of radiation used for cervical cancer is external beam radiation, similar to an X-ray, and brachytherapy, which is internal. Chemotherapy is another option. It can be really useful because it's able to reach all parts of the body, seen as though it is injected via IV or taken by mouth. Cisplatin is a common anti-cancer drug used in chemo. Targeted therapy is where drugs that target blood vessel formation. Vascular endothelial growth factor, or VEGF, is a protein that helps tumors form new blood vessels. Drugs called angiogenesis inhibitors stop VEGF from working and block new blood vessel growth. Avastin is a popular drug that is used for this. Lastly, immunotherapy, which helps stimulate a person's immune system to recognize and destroy cancer cells, is often used to treat cervical cancer that has spread or come back. Keytruda is often used as it targets your T cells in order to boost your immune response and target the cancer cells. What is the role of public health? Mostly it is screening and vaccinations. According to the CDC, the combination of screening and HPV vaccinations could prevent up to 93% of cervical cancers. Still, gaps remain. Women at the highest risk are often not screened, and HPV vaccination rates among U.S. adolescents remain low. Lastly, something additional of interest is that women of all ages are at risk for cervical cancer. So ladies, don't forget to get a Pap test starting at age 21.